and seek medical advice if symptoms worsen or if the child shows sign of severe illness, such as persistent high fever or unusual drowsiness. There is no specific treatment for hand, foot, and mouth disease. However, supportive care can help relieve symptoms and keep the child comfortable. This includes offering plenty of fluids to prevent dehydration, providing over-the-counter pain relievers or fever reducers such as ibuprofen or paracetamol, and ensuring adequate rest and avoiding spicy or acidic foods that may irritate mouth sores. The most effective way to prevent the spread of hand, foot, and mouth disease is through good hygiene practices. We urge all schools, parents, and caregivers to implement the following measures. 1. Hand washing. Ensure that children and staff wash their hands frequently with soap and water, especially after using the bathroom, changing diapers, or handling food. 2. Cleaning and disinfecting. Schools should regularly clean and disinfect surfaces and objects that are commonly touched, such as toys, door handles, and tables. 3. Isolation of affected children. Children with symptoms of hand, foot, and mouth disease should be kept at home until they are no longer contagious, usually about 7 to 10 days. 4. Coughing and sneezing etiquette. Teach children to cover their mouths and noses when coughing or sneezing using a tissue or the elbow and to dispose of tissues properly. The Ministry of Health remains vigilant and encourages the public to remain informed and to continue practicing good hygiene. If you suspect your child has hand, foot, and mouth disease, or if they develop concerning symptoms, please consult your healthcare provider. The Ministry of Health will continue to provide updates to the public on this situation.
All right, so just a reminder, some key symptoms of hand, foot, and mouth disease include fever, sore throat, fatigue, painful red spots or sores in the mouth, on the tongue, and inside the cheek, rash or red spots on the palms of the hands, soles of the feet, and sometimes the buttocks. And you can also experience loss of appetite in infants. So it's important to, have this information. And if you see those signs and symptoms, ensure that you take your child to a health facility or the doctor. And also it's important to keep them away from school during this time. And of course, as we continue on a more positive note, we did witness the renaming of the Victoria Hospital to the Sir Dr. Winston C.V. Paris Medical Complex. And of course, this renaming ceremony was hosted by the Ministry of Health, Wellness and Elderly Affairs. And Sir Dr. Winston C.V. Paris, who worked as the only consultant anesthesiologist at the Victoria Hospital, was honored and recognized for his invaluable contribution to the health sector in the area of pain management. His family, friends, loved ones of Sir Dr. Winston C.V. Paris, Cabinet of Ministers, and health experts and staff of the Ministry of Health were present to witness the renaming of the facility, and we'll take a look at that news report featuring the renaming of the Victoria Hospital to the Dr. Winston C.V. Paris Medical Complex.
The Ministry of Health, Wellness and Elderly Affairs has officially renamed the Victoria Hospital as the Dr. Winston C.V. Paris Medical Complex. The hospital was renamed in honor and recognition of the valuable contribution of Sir Dr. Winston C.V. Paris, who worked as the only consultant anesthesiologist at the Victoria Hospital and dedicated his service in the area of pain management. Permanent Secretary in the Ministry of Health, Jenny Daniel, recognized the renaming of the Victoria Hospital as a moment of great national significance and tied in the noteworthy contribution of Sir Dr. Paris to the health sector.
Today, we are not simply renaming a building, we are preserving its legacy while honoring one of St. Lucia's most distinguished sons, Sir Dr. Winston Paris. Sir Dr. Paris was a man whose life embodied excellence, service, and an unyielding commitment to the advancement of medicine and the well-being of people. His pioneering contributions to clinical medicine, his mentorship of younger doctors, and his unwavering passion for patient care have left an indelible mark on the regional and international community.
Minister for Health, Wellness and Elderly Affairs, the Honorable Moses Jabatis, said he is deeply grateful to Sir Dr. Winston Paris for his contribution and exceptional service over the years working at the Victoria Hospital.
That this government is committed to ensuring that your name, Sir Winston Paris, which will be etched on the walls of this institution, will be associated continually with excellence, the excellence which you brought to the world. We are going to ensure that we continue to work with you to cause St. Lucia's name to continue to be heralded everywhere in the world.
Parliamentary Representative for Castries South, the Honorable Dr. Ernest Haley, welcomed the renaming of the Victoria Hospital and said he is proud to have this health facility located and serving the people of his constituency. Prime Minister the Honorable Philip J. Pierre applauded Sir Dr. Winston Paris for his unwavering contribution to healthcare and said it is unquestionably necessary that he is honored, respected and loved.
I thank Sir Winston. I want the doctors and nurses to use him as an inspiration, a mentor. Somebody who can come from Marion Street in Castries and reach Duke University, Tennessee, speak to presidents, chair presidential councils, but still return, come back to St. Lucia and remain grounded and remain St. Lucian. I thank you for that.
Sir Dr. Winston C.V. Paris, who was present to unveil the sign bearing the new hospital name, expressed immense pride and joy to have his legacy honored. He also highlighted his vision for the health facility.
My hope for the Dr. Winston Paris Medical Complex is that it would improve the delivery of healthcare in St. Lucia, that it would attract new specialties to this facility, and in particular to St. Lucia, and that it would stimulate research inquiry into complex medical syndromes affecting St. Lucia and the Caribbean people.
The newly named Dr. Winston C.V. Paris Medical Complex is committed to delivering exceptional healthcare service to the people of St. Lucia. The Dr. Winston C.V. Paris Medical Complex comprises the Dr. Betty Wells Urban Polyclinic, that is, National Eye Clinic and Urgent Care, and the Millennium Heights Medical Complex Secondary Care Wing. Reporting from the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Fennel Neptune.
So we witnessed a very historic moment in the advancement of healthcare in St. Lucia. And with that, we're going to take a very quick break. Of course, when we come back, we'll be joined by our special guest, Dr. Shanna Sear-Filbert. She's the Senior Medical Officer for Non-Communicable Diseases, and we're discussing Know More, Do More for diabetes. So stay with us. We'll be right back.
You mean I can win a laptop or a tablet or a school bag with supplies? Are you dreaming? No, I'm not. It's right here. You can check it for yourself. I need to enter this. I am not missing the alcohol poster awareness competition.
All you need to do is create a hand-drawn and colored poster with the theme Alcohol-Free is a great way to be. Include a 100-word description explaining your poster on the benefits of being alcohol-free. It must have no violent images. Think positive. Open to all youth from 11 to 16 years old. Entries must be submitted to the Substance Abuse Advisory Council Secretariat on the...
Yes, that was St. Lucia Top 5 for Carnival 2025. Yes, welcome back to Real Men Take Charge, guys. Real Men, check up.
To all my listeners out there, visit a men's health clinic in your area today.
PSA checkups are now free.
It's private, it's quick, it's efficient, and convenient.
Music touches the soul. but health keeps the rhythm going. Fellas, it's time to check your PSA levels. It's free, it's simple, it can save your life.
Brothers, do you not know that your bodies are the temples of the Holy Spirit? Let us be wise stewards of our lives. Prostate test saves lives. Let us not wait until it is too late.
To be a champion, you need to show up for yourself. I'm encouraging every man to take the step. Get checked. Stay strong. Do it for the team. Do it for your family.
My daddy is a hero, and I want him around for a very long time. Daddy, if you care about me, please take care of your health.
I faced colon and prostate cancer head on, and I'm still standing. Early detection saved my life. If I can do it, so can you. Don't wait. Get tested. It's free, it's simple, and it will definitely save your life also.
Real men.
Real men.
Real men take charge.
Real men check up.
You mean I can win a laptop or a tablet or a school bag with supplies? Are you dreaming? No, I'm not. It's right here. You can check it for yourself. I need to enter this. I am not missing the alcohol poster awareness competition.
All you need to do is create a hand-drawn and colored poster with the theme "Alcohol-free is a great way to be." Include a 100-word description explaining your poster on the benefits of being alcohol-free. It must have no violent images. Think positive. Open to all youth from 11 to 16 years old. Entries must be submitted to the Substance Abuse Advisory Council Secretariat on the corner of High and Jizzle Street, or the Bureau of Health Education, Ministry of Health, Waterfront Castries, by Monday, November 24, 2025. For further information, call telephone number 468-7921.
Alcohol-free is the best way to be.
And welcome back to the Wellness Hour. As I told you earlier on in the first segment, the month of November is recognized as Diabetes Awareness Month, and World Diabetes Day is recognized on November 14th. And so we have one of our health experts joining us, Dr. Shanna Sira-Filbert, and she is the Senior Medical Officer for Non-Communicable Diseases. And it is always a pleasure of mine to have interviews with Dr. Filbert. She's very insightful, also very reassuring. And she just has a unique way of bringing across important messages in a way that everybody understands. But then you also understand the importance of what she is saying. So I'd like to say a special good morning to you, Doc. Thank you for joining us.
Good
Doc,
morning.
I know you're super busy as always, but more so during November.
Yes.
But thank you for taking some time to sit with us on the Wellness Hour and educate and inform our viewers. We really appreciate it.
Welcome. Good morning.
And Doc, just to start off, I always like to ask my guests just to give us a little background about your roles and responsibilities as a Senior Medical Officer for Non-Communicable Diseases. I think Fernell mentioned it had an addition to mental health. I'm not sure if that still stands, so you can also correct me and tell us about that.
So as of December, I'm now the Senior Medical Officer, not only of non-communicable diseases, but also of mental health. And of course, there was a reason for that, because mental health is considered the fifth major chronic disease, and also there is a very big link between chronic diseases and mental health.
Yeah.
So, yes. So what does my role entail? It's a big role, interesting role. So I'm responsible for the coordination of activities having to do with our major non-communicable diseases. We will get into defining that a little later, and of course the risk factors. I work across departments in the Ministry of Health, and I also work with regional and international organizations such as the Caribbean Public Health Agency and the Pan American Health Organization. The activities under my purview include planning, of course, for non-communicable diseases and their risk factors in terms of reduction of those, policy development, health promotion, education, research, which includes surveys. You would have heard of the STEP survey we did in 2019-2020. We also look at the non-communicable disease risk factor trends, morbidity or illness associated with non-communicable diseases, and mortality or deaths associated with these diseases. I'm responsible for collaborating across sectors, so there are multi-sector engagements, and also one of those I enjoy the most is what we call quality improvement for the management of diseases such as diabetes and hypertension. Of course, these are just a few of the things I do. But yes.
Wow, as you said, Doc, a huge portfolio. You wear many hats. I'm always intrigued when it's Caribbean Wellness Day and I get to interview Doc, because I know you're always so excited and happy about, you know, getting the youth involved, especially during that time. And I think that you guys had a very successful campaign this year at the schools. We witnessed that. And so it's just good to put, you know, the roles and responsibilities to the face. I know Doc's face is one that you would see a lot on a lot of our reports, you know, always out there, always willing to educate and speak to us and do those interviews. So again, Doc, we thank you for that. And Doc, could you just give us a more explanation for people who may or may not be familiar when you say non-communicable diseases? Why, you know, is this such a major public health concern for us in St. Lucia? Okay, so let's define. I always like to define things. So, you know, most persons hear us as a ministry talking about NCDs, non-communicable diseases. Let's break it down a bit. Of course, non-communicable, and we usually say chronic non-communicable. Chronic in the sense that it's long-standing, that the condition or disease is long-standing. It takes a while, and generally they're incurable, so they're going to be around for a while. They can be managed. Non-communicable in the sense that it's not transmitted from one person to the next. Okay. Yes, and so we have those diseases being responsible for most of the deaths worldwide, and unfortunately, and St. Lucia is no exception, of course. In St. Lucia, non-communicable diseases, and just in case you want examples, we look at there are 5 major non-communicable diseases as defined by the World Health Organization, and those would be cardiovascular diseases, and under these, you know, we have conditions like hypertension, we have heart disease, and so on. There's diabetes, in the second category. We have cancers, chronic lung diseases. Of course, in St. Lucia, most persons would have heard of chronic obstructive pulmonary disease, or COPD, which is affecting our younger men, unfortunately, and that, you know, that is so sad. And of course, we have the 5th edition in terms of our NCDs is now mental health. Yes. Wow. And just by way of figures, the World Health Organization estimates that approximately 75% of the deaths annually are a result of the non-communicable diseases. And in St. Lucia, over the past 20 years, according to our data, these diseases have attributed to about 82% of mortality, generally around 80% to 82% of mortality or deaths in St. Lucia. Wow, and Doc, I feel like those numbers are significant, not you know, in any way to put fear in people, but I guess just more caution and concern, so that we know and understand. These are some huge numbers attributed to your non-communicable diseases, and you just think these things, you know, with the right information, with programs like what we're doing, with programs like what the Ministry of Health is trying to implement and execute, we can see, you know, a reduction in those numbers, which essentially is an overall mandate and objective of the Ministry of Health and Wellness and the work that Doc, you and your team, you know, continue to do. So then when we think of this month, again, an entire month just to create awareness for diabetes and the specific day, World Diabetes Day, how has it become such a pressing issue for us here in St. Lucia? Okay, so we're talking about non-communicable diseases, or NCDs, and diabetes happens to be one of the major NCDs. Right. And generally, in the world and in St. Lucia, of course, NCDs are responsible for something called premature mortality. Every one of us wants to have our loved ones living for as long as they can. Yep. And so diabetes especially causes persons to
die before they are supposed to, but also it impairs the quality of life that he or she is going to have. And so that is very concerning, because that would impair the quality of life, it would decrease productivity. We've seen and we continue to see diseases like diabetes leading families into poverty, because when you have the breadwinner now maybe having an amputation and not being able to work as he or she could, or having a stroke and now, you know, maybe being disabled, of course, then the rest of the family now is left, you know, to suffer. And of course, we also have the associated high, what we call out-of-pocket cost.
Yes.
So you're paying a lot of money towards an illness, you know, to get it managed.
Manageable.
And that is taking the money from, you know, the rest of the what you would have done, the books for the children, the food for the children. So there is, in terms of impact, there is a high socioeconomic impact associated with non-communicable disease in general and, you know, diabetes. When we're looking at diabetes specifically, it is one of the leading causes of death in St. Lucia, and it has been actually for decades. We note that in our data coming from the epidemiology unit in the Ministry of Health, it has been the fourth highest cause of death for about the past 10 years. And, you know, that is concerning. When we did our STEP survey, which was, you know, just looking at a representative sample of St. Lucians across the country, you know, it was over quite a few months of the almost 3,000 persons sampled, we got 15.9% of persons had blood sugars that were abnormal, fasting blood sugars that were abnormal, and that included persons who were taking medication for diabetes. So that is concerning, of course.
And Doc, if you're sharing more statistics, would you speak to, you know, how prevalent is the condition among us, and some of the figures and maybe age groups who are more affected, and genders as well? I know you shared some with me and I'm still, you know, a bit shocked.
Okay, so we have data from our wellness centers. Unfortunately, we don't have all the data we want, because we don't have data from the private sector. STEPS would have covered the private sector, but generally our health management information system would collect data from our wellness centers across the country. And we've noted that persons with diabetes, that the fourth cause for wellness center visits would actually be diabetes. Additionally, we've had in our system, we have about 10,000 diabetics, you know, registered diabetics. And we note that the ladies or the females, we have twice as many females coming in for care in terms of diabetes as males. We know, just to make sure we're clear, men tend to have what we call poor health seeking behavior. So it may not be that there aren't men out there who are diabetic. It is that the women are coming in more. It could be that there are more women, but women tend to come to the know, wellness centers or go to the doctors more. But that is what we're seeing. And so, yes, so of course, in terms of deaths, if you have more persons coming in terms of females, you have more deaths in the females. That's what our data is showing. Over the past 10 years, diabetes has been, of course, in the top 4 causes of death in St. Lucia. And of course, when we look at mortality in St. Lucia or death, we're looking at all sectors, like everybody who dies in St. Lucia. So that we have mortality data for the country.
Wow.
Yes.
And are there any particular age groups that seem to be affected or at higher risk?
We note in both males and females that in the age group of 50 plus, there is definitely an increase in the prevalence of diabetes. That would be expected, considering in terms of risk factors, generally as persons age, the insulin resistance increases, their body's ability to deal with, you know, glucose, etc., gets impaired. So we expect that as persons age, they will, you know, possibly have problems, but still 50 is, you know, 50 is a bit young.
Right.
But yes, but it's in keeping with what is expected.
Wow. Again, and I mean, this information is just important to know, so that I feel when you know you have this information, you can do more, you can also do better, and that is in keeping with our topic, that the more you know, you're able to make better lifestyle choices, you're able to make better decisions, you're able to seek intervention at an earlier stage because you're now empowered with this information. So these are some of the reasons. It's really not scare tactics or to put fear, but more caution and concern to encourage you to get up and do the right thing, encourage your friends and family, encourage your co-workers, you know, to participate. I know there's always health screenings. Ministry of Health, they've always planning countless health fairs, and these services are always available, and you get your full numbers. I know the big campaign is Know Your Numbers, and that is just so important. You take for granted knowing your blood pressure, knowing your glucose, knowing your body mass index, but that information is unique to you, and it is so important to you. So you really cannot take that for granted. And Doc, when we think of maybe specific trends or patterns that you would have observed, we mentioned, you know, the age groups and genders, but anything to do with communities or anything like that?
There have been communities in the past that we noticed where there was more, the prevalence was higher, and so we've doubled our efforts in terms of those communities. So we did have areas like in the east of the country, and some places in the west and so on. So we have noticed that there are trends in that sense in terms of the data that we collect from our health management information system.
I think, Doc, one program that stood out for me was at one of the community centers where they invited some residents of the community, and they really, you guys gave them hampers, and it was, you know, the healthiest food that they could get, some machines for blood monitoring, blood glucose monitoring, and I just thought that was so, it was so advanced in terms of you really reached out to the community so that to ensure that their management, that they're able to manage, and I thought that was an exceptional program and a successful one at that.
It was, and that's what we're hoping to do, because we need to reach people where they are, and as you were rightfully saying earlier, persons need to understand the message that we're communicating. And they need to be a very integral part of their care. So if they understand what is necessary, they're more likely to actually, you know, do it. Of course, we know that there are other considerations, you know, surrounding, you know, how behavior change and how persons do. But at least we could, you know, meet them halfway.
And I have to say, based on what I saw, the participants, they were grateful. They were grateful for the activity. They were grateful for the information. They were just grateful for the assistance from, you know, the health experts, the health workers. And I thought it was a beautiful activity. And we need, you know, more activities like those. Because again, once you know more, you can do better, you can make better decisions. It defeats the purpose of you knowing that you're diagnosed with something, but you have no clue as to what it is. How do you manage it? How do you even encourage others to prevent it? So again, these programs, when I see them happening, I just know that there's a lot of hard work, you know, that goes into it, and to see the success of the product, it's always very important. And again, Doc and your team, you guys are always so awesome. But Doc, when we think of risk factors for diabetes, what would be some of the major risk factors?
Okay, so our risk factors are broken down into what we can actually change and what we can't. So what can't we change? We can't change our genetics. It's not possible. We can't change our age. We can't change our ethnicity or our race.
Right.
So unfortunately, you know, genetics are, you know, if you have first degree relatives and so on, with diabetes, and note, we're talking about type 2 diabetes specifically here, which is the most, you know, common type of diabetes. Of course, genetics, what we call runs in your family, you know, first degree family, you are more likely to have it. That is not to say that you have to have it, because I would tell people, just because you are more likely to have something does not mean you need to go get it.
True.
Yeah. We have to be proactive. Of course, as we age, as I said earlier, there is the risk of developing diabetes because our body's not functioning as it was when we were younger. There is also, in the black race or Afro-Caribbean persons, etc., we're more likely to develop diabetes. And of course, some of the literature talks about in the male sex is more common. So these are what we call non-modifiable, or things that you will not be able to change, right? As a risk factor. In terms of the risk factors we can change, which are called modifiable risk factors, we have things like physical inactivity, all right? Not having enough, not moving around enough, not being active enough. We have also, of course, obesity, and that's a big thing. We see in our survey that in our STEP survey, we had a serious issue with obesity in St. Lucia, especially in our females. Okay, in our population, we had about 65% of both males and females, that sample being overweight or obese. So that is a significant risk factor for diabetes. Of course, we already have the other ones, the risk factors we can change. We also have tobacco smoking, we have high blood pressure, we have inadequate sleep. People don't think of sleep as being an issue when it comes to a risk factor for diseases, and not just diabetes, for other diseases, but a lack of sleep is actually a significant risk factor.
Wow.
Tobacco smoking, I think I said that already. Ladies who've had diabetes during pregnancy are at risk of having, developing type 2 diabetes later on, especially ladies who've had babies over 9 pounds. Okay, so I just want to put that out there. And one of the risk factors is what we call a low socioeconomic status. And that kind of speaks to the fact that persons may not be able to, they may not be sufficiently educated to prevent the illness, and to actually, know what to do in terms of eating right, and that kind of thing, being protected from those toxic substances like tobacco smoking and so on. So that's one of those things. And of course, there's what we call the metabolic syndrome, which causes with high blood pressure, high triglycerides, low HDL. So there's a whole mix. So persons need to be aware of, as you were saying, okay, where am I?
Exactly.
What's my weight? What's my target for my weight? What weight do I need to be at to ensure that my risk is low, even if my father has diabetes? What do I do? How do I take personal responsibility? Yeah,
that's the preventative aspect of it.
Yes, that's it. Yes.
And Doc, funny you should mention that, because I remember going to a health fair one time in Greece on the playing field. And I, as usual, I take the opportunity to, do the checks and be a part of the screening, because I feel if I'm going to communicate about it, I would need to have, a personal experience. And it's just funny that at that time I had just started with the Ministry of Health, and when I thought of obesity, you think you just look at this person and you say, jokingly you say, because this person maybe looks a lot bigger or fuller, that person is obese. And then they checked my numbers and they checked my weight. And in conversation with the nurse, she said that I needed to be careful because I was crossing into the orange zone of obesity. And Doc, I watching the nurse like, what? You don't see, like, I'm grateful for the weight, but you're here telling me that I need to, watch my weight because I'm crossing into the orange zone of going into obese. And it just could not connect for me, because I'm thinking I will look at myself and I would never even put my name, with obesity. But there I was getting, because of my weight, because, body mass index, because of my age, my height, and all of that I was crossing over into that. So it was a shocker for me that, she was telling me this. And she was like, you need to be mindful of your your midsection, which, you know, most of the
Very
weight is.
true.
And doc, I
Very
was
true.
so shocked because I'm like, you know, obesity really isn't written on anybody's face. You
Nope.
cannot just stay there and watch somebody and figure because they look bigger than you or heavier than you, that means they could very well be healthier than you, because everybody, you know, we all have different body types. But I just, at that point, it was an eye-opener for me to think that she was telling me, you know, I would need to manage my weight, maybe lose about 2 to 3 pounds because I was crossing into the orange zone. I was so shocked, doc.
But and that's the thing. We look at obesity, and one of the concerns about obesity is abdominal obesity. You know, I'm sure you've probably heard about the apple versus pear shapes and so on. What they've found is that the more obese you are around your midsection, the more likely you are to have, you know, cardiovascular diseases and so on. So one of the screening methods we use is actually your abdominal circumference, which is, you know, it gives a marker. So yes, we do the BMI, which now says, okay, how, you know, how obese are you? But we also do, we go a step further, we do your abdominal circumference, which also gives useful information in terms of your risk. One of the things I tell people is, you know, as we have, you know, as we have more abdominal obesity, that fat that, you know, is under the skin, sometimes you actually have fat around your organs and all of that, and that of course is not good because they cause so many problems inside, you know, that you're not aware of until you probably do a blood test that pulls up, you know, that information. So, which is why the screening is so, you know, important, you know, knowing what the targets need to be, what should your ideal waist circumference be, what should your weight be. You know, one can argue, okay, well, I'm muscular, but come do that test and let's discuss it.
Exactly.
Yes.
Yeah, I honestly, doc, that moment was an eye-opener for me because I remember coming back to the office and I was speaking to the health educators and my colleagues and I saying, you know, they told me I have to be careful because I was going into the orange zone with obesity and I would have never thought. I think that day I wanted bread, I drink water instead though, because I'm like, you know, it was an eye-opener, but then I was just happy that I decided to go ahead and, you know, get the information because you just never know. And since then, once the opportunity comes, I always have my health card. They fill it out for me. I do my checks. I compare the numbers. So I just
so you do the follow-up, which is
Yes,
necessary. Okay.
yes.
We don't, and like you rightfully said during the program, we don't want to discourage persons. Oh, you know, we come with, you know, this very negative message.
Exactly.
It's about knowing. Okay, hey, this is where we don't want you to go. This is not the best option. All right, even if you're probably not where you want to be, let's do it together. Okay, get to know that information.
That's right.
And when you get to know, you can now act on that. I mean, it's going to be a process, obviously.
Definitely.
But you first have to be in the know.
Yeah, just having
Yes.
the information. And I was able to manage so many things because they would have realized that the top level for my high blood pressure was a little elevated and I was cautioned on that. You know, did another check and say health screening was the same thing. And so going back to realizing, okay, then I had preeclampsia with my pregnancy.
See?
And so they mentioned, you know, I may need to begin to manage it better.
Yes. So you see, it's all about, and that's what we're saying. When we're looking at taking proactive steps, that's what we want persons to do. So yes, daddy is diabetic, you know, mommy is hypertensive. What am I going to do?
True.
You know, am I just going to sit there and say, oh, well, you know, it's in my family, I might as well
Just
get it? No, I need to
exactly.
be proactive. You know what? I don't have to get this. There are things I could do. And even if I become hypertensive, there are things I could do to prevent the complications of hypertension or diabetes. There are things I could do to live well with diabetes. You know, I was, you know, overseas and I saw diabetics living very well, you know. For decades, they would be diabetic and they would have no complications because they knew how to manage, right? And you know, there was this mindset, I'm going to take care of me. You know, of course, they had supportive environments as well, which is very important.
Definitely.
Okay,
though.
but I think one of those things is to be in the know. And then, you know, act on what you do. what you know.
And so fitting with our topic and knowing your numbers. And that's why I just love speaking with Dr. Philbert, because it's just, you know, she's very insightful and it's welcoming when, you know, she gives you the information. As we said, it's not to scare you, but it's to empower you and to inform you. Now with that, we're going to take a really quick break. And of course, when we come back, we're still here with our amazing guest, Dr. Shana Cyril Philbert, and we're telling you about Diabetes Awareness Month and World Diabetes Day. So stick with us. We'll be right back.
You mean I can win a laptop or a tablet or a school bag with supplies? Are you dreaming? No, I'm not. It's right there. You can check it for yourself. I need to enter this. I am not missing the alcohol poster awareness competition.
All you need to do is create a hand-drawn and colored poster with the theme Alcohol-Free is a Great Way to Be. Include a 100-word description explaining your poster on the benefits of being alcohol-free. It must have no violent images. Think positive. Open to all youth from 11 to 16 years old. Entries must be submitted to the Substance Abuse Advisory Council Secretariat on the corner of High and Giselle Street, or the Bureau of Health Education, Ministry of Health, Waterfront Castries by Monday, November 24, 2025. For further information, call telephone number 468-7921.
Alcohol-free is the best way to be.
Every bed in our hospitals tells a story of someone's mother, someone's brother, someone's friend. And when that story of care is complete, it's time for the next chapter, home. But too often, discharged patients are left waiting hours, days, weeks, sometimes months, not because they want to stay, but because no one comes. We understand life gets busy, but every extra day they wait means another patient, perhaps in pain, perhaps in crisis, can't get the bed they desperately need. So when the call comes that your loved one is ready, please be ready too. Pick them up, bring them back to the comfort of family, where healing truly continues. Because caring doesn't end at discharge, it continues with you. A message from the Ministry of Health, Wellness and Elderly Affairs.
And welcome back to the Wellness Hour. Thank you so much for staying with us. Our special guest, Dr. Shana Cyril Philbert. She's the Senior Medical Officer for Non-Communicable Diseases and Mental Health, Mental Wellness. Of course, November, Diabetes Awareness Month, November 14th, World Diabetes Day. Our topic today, no more, do more for diabetes. Very important conversation. And Doc, as we were speaking, I wanted to get into a little bit of the programs, the screenings and the initiatives that are currently available for people who have, you know, diabetes, because I know there are so many support programs at all of our health and wellness centers.
Yes, so at every wellness center, there is always an opportunity, sir, for persons to literally walk in and ask to get a reading done. Okay, nobody gets turned away, and so that's one of the things I want persons to know. It's something we take very seriously. In addition to that, we have the capacity building project with Taiwan. That's a collaboration, and they do something called I, as in I, alphabet I, eye screening, and they would literally, our health aides and nurses, they would go out into the communities, they would go out into workplaces, and we're always happy to have workplaces reaching out to us, so we could, you know, do that screening. There's a non-invasive screening that is done called Find Risk for diabetes. It assesses someone's risk of developing diabetes based on like a questionnaire. So if for persons out there, sometimes persons are so concerned about getting, you know, their fingers
True.
stuck.
Very true.
You could do
Doc.
that first step. You could just find out what your risk is. There we do something called an HbA1c, point of care HbA1c as well. Through that program, we also have our regular outreach in our health fairs. We partner with workplaces.
Yes.
So on Friday the 14th, we will have some of our staff at M&C Bridge Street, and we'll be providing, you know, screening to those persons who come in.
Oh, great.
There will be, you know, on the day before that, some health education on diabetes. I will be doing that at M&C. And we have also programs running. We have My Plate, which looks at nutrition, which is a very important component of diabetes management. We are airing a few of those programs during the month of November, and we're targeting, you know, diabetics. So please feel free to tune in.
Yes, on all local stations, the primetime spots, you will see it. So just take a moment, Doc, and I really enjoyed that program because I learned so much about how we eat and just the importance of portions, and I try my best to stick to it. And I have to say, in terms of how I feel when I eat, I feel more nourished.
Oh yes.
So
you're
was
eating to live.
A game changer for me, Doc. Because, you know, for me, it's like, I love food, I eat in, and then, you know, you get the quote-unquote niggeritis. But after we put out that program and the sessions that we had with Ms. Hunt, our chief nutritionist, it was an eye-opener because you can really eat the things you like, healthier versions to the things that we love. Portion control was so important because you figure,
definitely,
you know, you sit there and you're feeling so hungry or your stomach grumbling and you figure, boy, you need a big plate of food, and that was far from the case. Just the right portions, and I feel so much better, Doc. It's life-changing, actually.
Yes, it is, and for our diabetics, that's especially important. One of the problems we have, not just for diabetics, but just in general, is that we eat. When we eat and how we eat is a serious consideration in terms of, you know, even developing, you know, conditions like diabetes.
Well said. So a lot of programs and a lot of initiatives, Doc. But when we think of once someone is diagnosed, the services, the support systems available through public health, and even their personal management.
We have, honestly, in St. Lucia, in our primary care system, I think we offer holistic management for diabetics. Yes. One of the as to how they take advantage of what is being offered, that might be, you know, an issue. So there are primary care physicians or district medical officers who provide clinics across the country in 34 wellness centers.
Yes.
And we have our primary care physicians. There are nurses, you know, we have nurses specially trained in diabetes management. We continue all year to do capacity building in diabetes management, especially because we know it's an issue, and we want our staff to be very well aware of how diabetes should be managed. We have our podiatrists, those persons who take care of the feet, and you know, of course, one of the complications of diabetes is actually the diabetic foot and ulcers and amputations, etc. So we have those persons who also form part of the team in terms of diabetes management. There's diabetic retinopathy screening, which is very important. So when persons have diabetes, they need to ensure that they get that screening, because early detection can save their eyesight, and of course we know how important eyesight is. We have an internist or a specialist doctor in the clinics. We also have special clinics for diabetics. You know, I actually run some of those. And there's the pharmacy, right, which is important. You know, most diabetics will need some kind of, you know, medicine, you know, as well, of course, as diet and exercise and sleeping well, etc. And those medicines are actually free in the pharmacies for the diabetics. You know, that is one of those things. Yes. Doc. That is one of those things that, you know, we've fought to have, and also the antihypertensives, because, you know, diabetes, the way it causes, you know, diabetics at some point tend to become hypertensive. So of course You know, we have drugs for hypertension as well, free. One of those things I think is very important for us to mention when we're talking about diabetes. I always say to people that when you have a chronic illness, at least 90% of the time you're managing that illness alone, right?
True.
Alone,
Very
or with
true,
your
Doc.
family, or with those persons closest to you. So one of those things that is very important in chronic disease management, and especially in diabetes management, is being able to get empowered and educated so that this individual can actually manage on his own when not with a healthcare provider.
Sure.
We offer a program called the Stanford Chronic Disease Self-Management Program. That program is evidence-based. It is not a St. Lucian program. It's actually a worldwide program. It's American, and it has existed in St. Lucia. It's been done in St. Lucia for the past decade with very good results. And it is offered to all of our diabetics, especially the newly diagnosed diabetics. So I just want to appeal to persons who may have a family member who's diabetic or who may themselves be diabetic. You can go into any wellness center and ask to be registered to be part of that program. The program runs for 6 weeks, but every week it's just 2.5 hours. Okay, it's a small group, so persons will be put into groups up to about 16 persons, and they're not run at the wellness centers. They actually they tend to be run at other institutions. So for example, a school on an evening, you know, so it's not necessarily during the day. Yes. It's, we also had started online, of course. I'm not sure there is an online component at this stage, but currently we have 2 chronic disease programs running as we speak. We have one at Jackmill, and we also have one in Dennery. So if you want any information, you could call the Bureau of Health Education. You could call your nearest wellness center, of course, to get registered. We've found that the chronic disease self-management program really helps persons get better control of their disease. It helps with, you know, sometimes persons get diagnosed and they're very sad about the whole diagnosis. It helps them cope with that diagnosis and you know, not feeling like they're alone and they don't have that information. And like I said, being in the know is really important. You know, that empowerment and being able to manage, you know, is very important.
I love that, Doc. Is that the courses are for free when you always
The courses are definitely for free. They are given by persons who've been trained in self-management. It's one of those programs that we need to be registered for every year. So it's not just anybody coming to teach you and coach you. Okay, it's a very well recognized program.
They're trained, yes.
And we do capacity building all the time. We have cohorts, and they're programs that you could actually train non-healthcare professionals to actually do them.
I love that. And I can identify with Doc because in the communications unit we've had the privilege of, you know, attending and, you know, doing the communication aspect of these. So I've seen them in action at the workshops. It's a lot of detailed information that these trainers get to now go into the communities to train you with self-management. So it's very important. And Doc, when you think of that, the self-management, how important is it to have the family support as well?
It's definitely very important. Just before I forget, I just want to plug that in. For those of you who may feel that we're only offering self-management, chronic disease self-management in English, I assure you it's also offered in Creole, okay?
I love that.
So we're making sure that everybody's covered.
There are no barriers.
Yes, so don't say that you're not going to the health center to get registered because they might not reach you. They will, I assure you.
I love that, Doc.
Now, back to your question.
The family support.
The family support. That's the whole point of the self-management program is not just for the individual. The individual could actually come to the program with his or her family member. So for example, we have males who may not be doing the meal preparation or you know, who don't do some things. You bring the wife along. There may be an elderly person who has a daughter who cares for him or her, or a son,
True.
that person comes along. So it's a team effort into that management. And of course, like I was telling you, the results are awesome. I had a patient who years ago who did not speak that much English, and I had been struggling with her as a physician in trying to get her well controlled in terms of her diabetes. And I saw her, she came in and she was controlled, and there was this wow, what did I do differently? And I decided to ask, ma'am, what happened? And she says, in Creole, I don't know if I'm allowed to speak Creole.
Yes, please, Doc.
She said, doctor, yo vini an health center, ek yo mette man di dan ti class, ek na pon telma bagay, ek maya pon sa pou fe. So na fe sa, ek na fe si, and whatever, and it was so heartwarming. I remember calling the nurse who was running the program, and I said, so and so, my gosh, this is a success story, and I thought, if this individual could do it, everybody else could do it. And so I just want to ensure that, I want to encourage persons to go out and ensure that you get enrolled in the self-management program.
I love that, Doc. I think I met a gentleman at one of the programs. He said his wife, he was diagnosed with diabetes, but he came along with his wife because he mentioned the very same thing. She does all the cooking, so it's important for her to have the knowledge and information.
Exactly.
And he said that, she keeps him in check with his medication, with doing his checks. She takes out the machine, she does everything for him. So, just knowing that, again, it's a team effort.
Team effort, yes. And the family members need to be supportive. We have persons who come in by themselves. I say sometimes, don't let your family member come in by himself. He may not remember the information, but if you come in with him or her, then that information, and you may have questions. You may be able to say, doc or nurse, this is my concern, because it's a conversation and it's a partnership.
Beautiful. Doc, I know you took us through some of the activities and the campaigns. And look, you really mentioned the success story as well of, what we're seeing with these programs. But just as we wrap up, Doc, what would be your final message, that you'd like to share with St. Lucians who may be living with diabetes or at risk of developing it, people who are, family members with persons with non-communicable diseases? What is your final take-home message?
I think one of the things I really stand for is don't give up. When persons are diagnosed, they tend to think that, okay, this is the end. It's not the end. It's a new beginning. It's a beginning with a challenge, but there needs to be positive mindset. So this is the challenge, but we're going to rise to that challenge. And like you said, one of the things I always tell people, diabetes and type 2 diabetes, it can be controlled. So don't just throw up your hands and decide, oh no, I can't do anything about this. No, that is not true. I've lived long enough and I've seen enough to know that it can be controlled. You have to start by knowing about your condition, as we said. You have to be empowered, enroll in the self-management, that act on what you know. People can live well with diabetes, with family support, with the support from their healthcare providers. Eat well, sleep well, be physically active, know your targets, monitor blood sugar levels, etc. Avoid toxic substances, and always know that you're not alone.
Beautiful. And Dr. Sarah, I just want to thank you so much for joining us again. I know this is a busy month for you. Keep doing the amazing work that you're doing with your team. We absolutely, appreciate that. And just to remind each and every one of you that we're asking you as part of, activities to observe Diabetes Awareness Month in collaboration with St. Lucia Moves, as the Ministry of Health, we're encouraging everyone to show their support. So, of course, wear blue every single Friday in the month of November. Join the movement. You can take a photo in your blue attire, snap, post, and tag us on Facebook as well as Instagram. Together we can raise awareness. So every Friday in the month of November, wear blue. Come out to the screening activities. As Doc mentioned, November the 14th, which is World Diabetes Day, there's going to be a screening at MNC. Come out with your co-workers, take your lunch hour, bring your family, bring your friends, and just support the initiative. Again, know more, do more for diabetes. Doc, thank you again so much. Any other information, you can always share it with me or Dr. Werner, and we'll pass it on to our viewers. Again, thank you to the viewers for joining us for the Wellness Hour. Thank you to the team here at Hot 7. You guys are amazing, and I'll see you next Thursday. Have a great Thursday.
7 TV is the rising star of television in St. Lucia with our stunning 100% HD quality, fresh exciting programming, including a balanced professional newscast. We are now the fastest growing TV station in all time slots on cable. Additionally, over 10,000 households carry our plug and play antennas. Our mobile app has over 11,000 users locally and over 300,000 users worldwide. Keyword to find our free app in the App Store is Caribbean Hot FM. For Kiss FM, swipe twice.